Hi, I'm Dr. Richard Amy. Many of you know me as the Laser Doc. I've been using lasers since 1998, so we're going on almost 25 years now. And I love using laser and doing laser therapy just as much today as I did 25 years ago. When I was introduced to lasers back in 1998, they were a lower class laser we called a class 2, and with a protocol, when you went to use it, was predominantly for treating pain. So if you had wrist pain, you would take the laser and you would laser 30 seconds here or a minute here, and that would be it. Well, my background is a chiropractor, and then my postgraduate degree was through the Carrick Neurology program. And so I understood that when treating the wrist, only about 20% of the time does it ever start in the wrist. It starts up in the neck or in the elbow or in the shoulder, and you need to do a combination of multiple different things. I also trained in some acupuncture. I trained on Dr. Brimhall, understanding percussion work, cranial sacral work, and a whole bunch of different things that helped me understand and appreciate how the body worked. And that was really, really important, because once I understood more and more how the body worked, I took the laser from a point and shoot to actually doing some incredible neurological things where I used acupuncture points and I used different nerves and areas of the brain to help the body release pain and increase range of motion and increase muscle strength. So for 40 years, people have been trying to get FDA approval with lasers, and they weren't able to do it because they were going based upon pain. Pain is very subjective. My pain is different than my wife's pain, different than a middle linebacker in the NFL, a hockey player. Everyone's pain is different, so that's called subjective. So what I did is I looked at the AMA guidelines for pain and disability, and I used range of motion and muscle strength. And I included those into doing a protocol, actually two 100 patient protocols for treating neck and shoulder pain. So I did 2 clinical trials, and after that second clinical trials, we were awarded market clearance for lasers the first time in the United States ever. So in 2002, we got market clearance, and boy, things have come a long ways. At that time, there was maybe only 1,000 studies in PubMed on low-level laser therapy. Today, there's over 10,000. It's just exploding. So because I knew more than the manufacturers, because I started applying it not only locally, but neurologically. So I created a course called Laser Applied Neurology for continuing education, and I've trained probably over 25,000 to 30,000 health professionals, not only PTs, chiropractors, dentists, plastic and cosmetic surgeons, functional medicine people. So I really have a wealth of information, and I've come a really long way. In the beginning, I had these little tiny books like this back in 98, 99, and these books have really stood the test of time, which I'm really proud of. But this first book was really about my top 10 laser protocols and the A to Z protocols for treating low-level laser for a variety of different things, predominantly for pain, and then for some other things as we advanced on and we knew more about lasers. Then I created another booklet with James Oshman, who's really phenomenal, written multiple books. And if you really want to understand therapies and understanding that, James Oshman taught me a very lot, and this was the booklet that we had. I learned a lot from him, so he gave me information. I helped him understand lasers, and this is one of the most fantastic books ever that I learned a ton of information from James Oshman, and we did that coupled together. He really helped me advance. But when you understand that the body, and the body number one, the body is electric. So this is a great book by Becker, understanding that we are a receptor-based organism, the body is electric, and the laser causes a photochemical effect when the photons hit the cell that cause a photoelectric effect, which is phenomenal. And then there's Molecules in Motion. Candace Pert, this is another great book that I learned a bunch from. But really, when it came down to understanding the cell and how the laser works, Gilbert Ling did a phenomenal job. And this book is really technical, really detailed, but yet it understands how the laser works, where it only takes necessarily one photon to create a cascade effect. So from this manual to working with James Oshman, now I have a huge manual. You can see how big it is here for treating over 250 syndromes or different types of things that might be out there, everything from pain to allergies to treating infections. We've seen a lot in this era with viruses and long hauler. We treat those as well. And then we have some for animals, and don't forget our big animals, the equine. So I've created a bunch of manuals, and again, they have stood the test of time. So I'm Dr. Richard Amy. I created most of the information here. I was the first ever to use lasers and then use a laser with precision frequencies or pulsations. And from what I understood and learned, I became the trainer to the trainer. So I trained Dr. Brimhall. I trained also in the AK world, Dr. Mladenoff. Jeff Spencer, who did the Tour de France and did a lot of elite athletes, I trained him. I treated Dr. D'Onofrio. I trained him. The late Dr. D'Onofrio was phenomenal for me, really understanding the neurological part. I treated and worked with Dan Murphy. And so I trained the trainers. In the physical therapy world, it was Donald Chu and Joe Kleincourt, who is really a good friend of mine. And then we had the animal. So I also helped train Bill Inman, that just had a phenomenal career helping using laser therapy in the veterinarian world. So I'm Dr. Richard Amy, and that's a little bit about me.